This is a warning to every hospital system owned by a private equity firm. Hey guys, this is Charlie. I want to bring up something right now that's happening close to home physically for me. I think it's kind of contextually relevant because it's probably happening all over the country. If you live in the Delaware County, Philadelphia region, you've probably heard that Crozier Health is shutting down. And this is including Chester Medical Center, which is Delaware County's only trauma center. Delaware County is a big suburb of Philadelphia. They just lost their only trauma center. Besides over 2,000 people losing their jobs, thousands of patients just lost access to critical care or the access that they once had. As someone in EMS, this is sending shockwaves. We have to change a lot of response operations out there in Delaware County. But I want to talk about why this is happening. Crozier was owned by a private equity firm. It's called Prospect Medical Holdings, and they're not even in Pennsylvania at all. I think they're in like Texas or California, or I think it's California or something. They're not in Pennsylvania for sure. And they bought the system and basically made a ton of financial decisions, which were probably beneficial for them in the short term, but in the long run, just did not hold up. And we're here now because of that. Simply put, when private equity prioritizes profits over patients, communities, healthcare workers, politics, it all suffers. So after Prospect bought Crozier in 2016, they made a lot of decisions that kind of inevitably would lead to a downfall. For example, they repeatedly paid out substantial dividends to their investors, basically to increase the company's debt burden, so make it a little more financially stable for the time. So it also sold all of the hospital's land back to the state and then leased it back. So it provided them some immediate capital, but there were a lot of long-term obligations that they, couldn't financially handle. In fact, Prospect was sued in 2024 for mismanagement and neglect of the Crozier Health system, specifically for distributing those dividends to investors at the same time that they were cutting services left and right. And this came back to bite them in the ass because when it came down to the wire, their deteriorating facilities and basic standards, they couldn't get a buyer. And they tried. It almost happened with Penn Medicine, but Crozier could not uphold their end of the bargain facility-wise. And pretty much everyone, including the governor, is attributing the closure of this hospital and its effect on the community to financial greed and mismanagement. Here's the thing, a lot of health systems are owned by private equity firms. And in cases like this, where the only trauma center in the county is owned by a private equity firm, there just has to be more scrutiny on financial decisions. If you've worked in the region, if you've worked at Crozier, let me know your thoughts. And if your health system is owned by a private equity firm, what kind of decisions do you see being made? I want to wish best of luck to the community and to the providers. Come join the coalition. Email us if you want to talk.